Hello everyone, this is Dr. Rahman. I'm an endocrinologist. Welcome to District Endocrine. Today we are going to talk about osteoporosis. This is a two-part video. In one first part we're going to talk about osteoporosis, and in the second part we're going to focus on the treatment. So let's get right into it. Let's get into it. How do we know that somebody has osteoporosis? So the diagnosis requires a detailed clinical picture. The first test is DEXA scan, which is a bone density test which looks at how your bones are. If your bones are deemed weak on the DEXA scan, the next step would be for your doctor to evaluate you clinically and check some labs to make sure you don't have any other medical condition which can also result in low bone mass. Now, to make the final diagnosis of osteoporosis, this is not a solely based diagnosis on DEXA scan, which is a very common mistake. If your T-scores are less than minus 2.5, you may likely to have osteoporosis. The diagnosis requiring clinical overall factors also needs to use a FRAX score, which is a score developed by World Health Organization. And that score will tell you how much is your risk for osteoporosis. And if your score is higher range, even with low T score, you will still be labeled as osteoporotic. There are several medical conditions that can lead to osteoporosis, like bone loss. It is important to make sure that your physician is ordering these tests to make sure you don't have any of these conditions, such as long-term calcium or vitamin D deficiency has also have shown to have similar effect as osteoporosis on your DEXA scan. And the disease caused by chronic vitamin D and calcium deficiency is called osteomalacia. So this is important that your healthcare provider distinguishes that and finds that you actually have osteoporosis correctly diagnosed, because the treatment is going to be different. The treatment for osteoporosis includes lifestyle changes, vitamin D and mineral replacement, as well as medications. The first thing we're going to talk about is in the lifestyle is the exercise. Weight-bearing exercises, resistance exercises have shown to improve overall bone health. Patients who have weaker bone in osteopenic range can easily treat themselves with exercises. However, this cannot be used as a sole treatment options for osteoporosis. Balanced exercises are important to prevent the risk of falls. Basically, if you have a lot of risk of falls, we want to prevent all the falls. Maintaining a healthy lifestyle will help to reduce bone health. Start regular exercise program, make a habit about walking, jogging, aerobics, weightlifting, as well as strengthening your bones. Replacement of vitamins and minerals. So vitamin D is an important replacement hormone. It directly impacts the overall bone health. It is recommended to keep your vitamin D levels above 30. If your levels are very low, you may need a shorter duration of high dose vitamin D replacement. Over treatment of vitamin D leading to toxicity is not recommended. It can actually further cause bone loss. Calcium replacement is important. Calcium is calcium is deposited in the bones. It is recommended to have at least 120 elemental milligrams of calcium to be consumed every day. It can easily be achieved with 3 to 4 servings of dairy products like milk, yogurt, cheese, etc. Those who are unable to take dairy product should take calcium supplementation, which are easily available over the counter. You should also make sure that you are not taking calcium empty stomach. Take it with your meals. So in divided doses, like if you are having 3 meals, so maybe 400 each meal basically. In terms of the medications, there are several kinds of medications classes used for the treatment for osteoporosis. Based on the medical conditions as well as the severity of osteoporosis, your physician will decide what is the best treatment option for you. The first most commonly used medications include the class of bisphosphonates. These are known to be anti-resorptive drug medications class. This class stops the reabsorption of the bone tissue. There are several formulations from oral to infusions are available. This medication can be given daily, monthly, weekly, or even yearly, depending on which one are you selecting. This class of medication shows to improve overall bone health as well as to reduce your fracture risk up to 50%. Common medications are as follows. For example, we have alendronate called Fasamax. The other medications include Boniva, such as ibendronate, rezidronate, Actonol, and zoledronic acid, such as Reclast, which is a yearly infusion. In terms of the complication, there are overall extremely safe medications. However, they do have some complication risk. Um, so if you are going for an oral medication option such as Fosamax or alendronate or others, you should stay erect after taking the medication for at least 30 minutes. Drink a lot of fluid or water to make sure the drug is in the stomach and not stuck in the food pipe. Fosamax can lead to heartburn and can cause worsening of peptic ulcer disease. Um, all these bisphosphonate drugs have potential to cause atypical femoral fractures. Very rare, but it can happen. They can also cause jaw osteonecrosis, which can result in delayed healing of the jaw. Now, these two complications are extremely rare. Other things to worry about is that patients can have flu-like symptoms, fevers, and headache, which are common after these medications, or they can also have an impact on the kidney function. Hormone and related therapy. Now, this class of medications includes estrogen, testosterone, or estrogen-based medication called raloxifene or Evista. These are not commonly used except when they are indicated in selected cases. These medications are selectively used in those patients who have testosterone deficiency with bone loss, such as men with hypogonadism, or they can also be used in females where they have hormonal deficiency, or if the first line of medications such as bisphosphonates or Prolia cannot be given in these patients. The reason for that is there is a potential for certain complications such as blood clots, heart disease, and certain kind of cancers are more prevalent because of these medications. The next class is biologics, which includes denosumab such as Prolia. This is anti-resorptive medication such as just like bisphosphonate, but it is given every 6 months is with an injection. It's used for patients who usually have failed who have failed bisphosphonate treatment, or there is a contraindication for bisphosphonates. This can be used in patients who have kidney dysfunction or kidney disorder. This class shares many similar side effect profiles such with bisphosphonates. In terms of the side effect wise, we can have patients who get like a flu-like symptoms when they get the injection. They can also have atypical femoral fractures, which is very rare. And then they can also have the osteonecrosis of the jawbone, which is delayed healing of the jaw, and very rare. The thing to prevent is to keep a good oral hygiene, and these are extremely rare side effects. But overall, Prolia is a very good drug in terms of reducing your risk for osteoporotic fractures and improving your bone density on the DEXA scan. Anabolic agents. So this is a newer class of osteoporosis medications which focuses on bone formation. This class is usually used in severe osteoporosis patients with fractures. There are three main products which are currently approved by FDA. So the first one is romosozumab Evenity. The second one is Forteo teriparatide, and the third one is abaloparatide, which is Tymlos. Now, this class of medications usually requires injections which can be up to daily, such as in Forteo, or it could be monthly. There is slight increased risk of bone cancer associated with these medications. Those are the studies from animal data only at this point. However, FDA does have a warning about it. So the most common question is who should be treated with medications for osteoporosis? Well, patients with low bone density, if it is less than minus 2.5 or lower, should be considered for treatment for osteoporosis. Those patients who are bone density is actually better than minus 2.5. However, they have a lot of clinical risk factors, and based on the World Health Organization fracture risk assessment tool called FRAX, is used to see if if those patients do qualify for osteoporosis treatment. If a person already has an osteoporotic fractures, regardless of their T scores as noted in the DEXA scan, those patients do qualify for treatment and they have osteoporosis. And that again tells you about the issues associated with the DEXA scan. So even if your T score is not worse, if you meet clinical significance, you do have a diagnosis of osteoporosis. The next question is how do we prevent osteoporosis? Diet and lifestyle modification, as well as making sure you are taking enough calcium and vitamin D, are important steps to prevent osteoporosis. Patients should also make sure that their home has enough light, especially at night, as well as there are no loose rugs to slip and fall. In winter time, be careful when you're going out in snow and rain. Make sure you don't fall. There are specific changes done in your washroom, restroom, so that you make sure you don't fall, and you do have stuff to hold on to if you do slip. So those are simple things that can be done to prevent osteoporotic fractures. Thank you so much for watching another episode of District Endocrine. This is Dr. Rahman signing off. Please don't forget to visit our website www.districtendocrine.com. And a disclaimer, there is no sponsorship or any conflict of interest for this particular video. Don't forget to like, subscribe, and share. Thank you very much.